Yes po?
Ano po ba ito?
Yes po. Pasok po kayo.
What brings you here, ma'am? Dok, sakit dito bandi. Hirap umihi. Parang ang hapde.
Okay, sige po. Go to the diagnostic lab and request for urinalysis. Here. Do you have any back pain?
Yes po.
Do you have any pain when you're urinating? Okay, so here's a list of foods you can see here. These are the foods that you should avoid, okay? Also, I will be prescribing you tamsulosin, which is also Floxam. You can get this over the counter naman. So,
Dok, wala po ibang way dyan. Plan B, gano'n. Yung po yung pain. Dok, ang dami kong gagawin eh.
actually, there is another way. It's quite new. It's a specialized procedure that I have been working on. And I will be using a specialized suit to do this procedure also. And I'm also very willing to do this procedure for free.
Sign me up!
Are you sure?
Yes, Dok, please.
This is quite
Hindi,
new.
okay lang, Dok. Sige, try na natin.
Are you sure?
Yes, Dok. Sure, positive. 100% sure that's it.
Okay. Nurse Yuri, may you let her sign the forms, please?
Hello. Ano po yung waiver? Pakibasa na lang po. Kasi. Pwede po ba daw? Thank you.
Collaborators, assemble.
Figuring out a fascinating case, aren't you?
Well, having us to witness your case and lend our extra knowledge would go a long way, isn't it, Dr. Dean?
The well-loved anatomists in town are back.
Don't forget this guy who made understanding the body functions easy. Or did he just make it complicated for the medical students? Well, hi.
Don't worry, Gaigan. We're the
inconstant love and hate terms of these medical students.
Wait, I'm here! Who says identifying big and small circles all in pink color is not fun? Kidding aside, hi Dr. Dean! Nice seeing you!
Harper, can I start by asking what should I take note of in this case? I'm suspecting it to be UTI.
Stones, microorganisms, and urine are important elements in this case. If you suspect it to be stones, know the difference between calcium oxalate, struvite, uric acid, or cysteine in correlation with your risk factors. As for microorganisms, keep scan via mnemonic you would like to recall: Klebsiella pneumoniae, Enterococcus faecalis, Enterobacter cloacae, Pseudomonas aeruginosa, Proteus mirabilis, Staphylococcus saprophyticus, or Serratia marcescens.
That's so awesome of you, Harper. I agree with everything you've said. But based on the laboratory results, this was positive for calcium oxalate. Interestingly, it is the most common type of stones formed and would cause too much pain among patients.
I bet Netta and more have something more to add. Kidding aside, when there is too much waste and too little water, crystals begin to form.
Stone-forming chemicals are calcium, oxalate, urate, cysteine, xanthine, and phosphate. Plenty, right?
Truly. But from what you're planning, I think Junquera has something also to say.
Let's first start with the main organs that are involved in the system: kidneys, ureter, bladder, and urethra. Come, let's dive deeper into the histology portion of this wonderful and interesting system. A. Ureter. Transitional epithelium and smooth muscle. Coats. Mucous membrane that consists of transitional epithelium in longitudinal folds that is supported by a lamina propria of dense connective tissue. Muscle coat with inner longitudinal and outer circular muscle fibers. adventitial layer of fibroelastic connective tissue. B. Urinary bladder. Urine storage, loosely arranged layers of smooth muscle and elastic fibers that contract during micturition. Inner longitudinal, outer circular, outermost longitudinal equals detrusor muscle. Transitional epithelium with umbrella cells with junctions, thick luminal plasma membrane with thickened plaques. Urethra. Layers. Tunica mucosa, protective mucous membrane, houses clusters of mucin-producing cells called urethral glands. Tunica muscularis. Primary smooth muscle fibers help propel urine to the outside of the body. Lined by transitional, pseudostratified columnar, stratified squamous non-keratinizing. Female urethra. Shorter, shape of lumen, crescentic, thicker width, no presence of fibrosa.
Now that we know the generalities and normal findings in a healthy view, but what are the ones that we should take note in acute and chronic UTI?
During chronic UTI, the urinary tract doesn't respond to the treatment and just keeps recurring. In most cases, the bacteria that entered into the system multiplies, which results in an infection.
How did she develop UTI?
I think our guy, Ton, has answers for that. The floor is yours!
Ha ha ha. Very funny, Junkara.
Doc, what is the pathophysiology of our patient with suspected UTI?
So, before going into the whole disease process, let's first start with understanding the physiology of the urinary system.
After the formation of urine in the nephrons of the kidney, it flows through several structures in the kidney. First, from the kidney, via peristaltic movement, urine flows to the ureters going to the bladder. Second, the bladder holds the urine until urination occurs, emptying urine through the urethra. Third, after urine accumulation of at least 300 ml, the bladder will contract while the internal urethral sphincter relaxes. Then, the individual would feel the need to void or urinate. Urinary tract infection when there is an invasion of bacteria, commonly Escherichia coli, into the bladder or in the urethra. This causes irritation and inflammation of the cells in the urinary system. Neutrophils will now respond. However, due to certain virulent factors, bacteria multiplies and are able to evade the body's immune system. For example, E. coli. E. coli can bind to the cells in the lower urinary tract and hide from the immune cells. The bacteria can form biofilms, which is a group of microorganisms where they stick to each other and mostly adhere to the surfaces of the urinary tract, allowing them to proliferate and survive.
What are some of the symptoms of UTI?
Well, at times, UTI does not always display symptoms, but when it does, it always causes a person to have a strong urge to urinate, having a burning sensation when urinating and urinating often but in small amounts. As for the urine itself, it usually looks cloudy or appears red, which is a major sign that the blood is present, and having a strong smelling urine.
What are some of the symptoms of kidney stones?
Symptoms of kidney stones consist of feeling pain in your lower back and or the side of your body. This pain can either start as a dull aching pain, which comes and goes, but can also develop into severe pain. Other symptoms can include being nauseous or vomiting, seeing blood in your urine, feeling pain when urinating, being unable to properly urinate, feeling the need to urinate often, having fever or chills, and having a strong smelling urine that usually looks cloudy.
What are the lifestyles that lead to UTI?
Certain lifestyle choices that usually lead to UTI consist of holding back urine when feeling the need to urinate. This causes the bacteria to grow. Not passing urine, or not drinking water after intercourse, and lastly, not washing genitals daily.
What are some of the lifestyles that lead to the kidney stone formation?
Common cause of kidney stones include dehydration, obesity, having a diet with too much salt, protein, and glucose, as well as medications such as calcium-based antacids and triamterene, which can cause dehydration and electrolyte imbalance. Certain diseases and conditions can also contribute to causing kidney stones. An example of this would be inflammatory bowel diseases, which leads to an increased absorption of calcium.
How often do women get UTI?
My
got you, my guy. More than the figures and the sketches, I can give you the knowledge you wanted to. Here it is. UTIs affect women up to 30 times more frequently than men. Furthermore, up to 4 in 10 women who have UTI will have at least one more within 6 months.
Possible that MC's high pain tolerance may be due to her gender?
It is possible. Due to their larger nerve density than men, women may feel pain more intensely. Changes in female hormone levels may increase their threshold. For instance, decreased estrogen levels throughout the menstrual cycle or after menopause enhance the activation of pain receptors, making the body more sensitive to pain.
Tell me about the urine formation.
Hey, you, More! Help me now with this. I know you're one of the favorite author being referred to by medical students.
Woohoo! Well, it's just me. More knowledge, more information from more. Here! Blood enters the kidneys and is filtered by the nephron, which is composed of glomerulus and renal tubules. Inside the nephron, glomerulus is located in the Bowman's capsule. It is a non-selective filter of plasma substances of less than 70,000 molecular weight. In the proximal tubule, it reabsorbs water, sodium chloride, bicarbonate, potassium, calcium, amino acids, phosphate, protein, and glucose. It secretes sulfates, glucuronides, hydrogen ion, and drugs. On the descending loop of Henle, water reabsorption happens but no solutes are reabsorbed. At the ascending loop of Henle, solute reabsorption happens where it absorbs sodium, chloride, calcium, and magnesium. No water is reabsorbed. Distal convoluted tubule and collecting tubules is where sodium reabsorption happens. Potassium, ammonia, hydrogen ion secretion.
What are the common treatments for UTI?
Home remedies: drink more water, avoid drinks such as coffee, alcohol, and carbonated drinks which contain citrus juices or caffeine that can irritate the bladder and increase the need to urinate. Use a heating pad to lessen discomfort.
Behold Ding's specialized suit, equipped with propellers and antibiotic bombs belt.
Mami, insert ko na po
Masarap ba yan? No! Quick! Hey, WBC! How long has this been going on?
Around a month? Do you need assistance?
Give me a tour.
This is one of the great ureter trials.
Wait. There it is.
Warning.
Oh no, my battery's running out.
What's happening?
Ma'am, stop moving po.
Wait!
Kalma lang po.
Whoa!
Welcome back, Doc.
Doc, what are those big masses found in my body? We'll discuss this all in the clinic. I'll just fix myself first. Nurse Yuri, please help our patient.
Will do po, Doc.
What we've seen in your kidneys are what we call kidney stones.
Kidney stones?
Yes. This is found in your kidneys. These are solid masses made out of crystals. For now, we've taken out most of your stones, but please follow my prescription here. Is the list I gave you. You have to take this twice a day, of course. Get a lot of rest. Eat healthily from now on. And don't worry, we've taken a big portion out. So you'll recover just in time as long as you follow my instructions and the prescription I have given you.
Oh, ito na. Toyo lang po. Saan ka ng madami? Ma, kahit toyo yan, masarap yan eh. Nay! Tok! Ano po nangyayari sa nanay ko, no?
Kasama ka ba? Mas nakakapagod sa'yo?
Wala Hanggang po dalawa na tayo ito na.
Kasi bali, wala kasi yung kondisyon ng nanay mo dahil sa hindi naagapang UTIs. Kaya kailangan natin siyang dalhin sa mas malaking hospital dahil wala tayong sapat na kagamitan dito sa barangay.
Ma, papunta na yung ambulansya. Hintayin na natin, papunta na. Gagaling ka, ma. Tahan na. Wala kang ginawang mali. Basta pangako mo lang sa akin na magpapakabait ka. Lagi mong alagaan sa sarili. Ma, huwag mo sabihin yan, ma. Pasensya nga na. Hindi ka dapat bigyan ng ususap ng pagkain. Pero alam mo na, kahit wala tayong masyadong pera, makita lang kita kumain. Busog na ako.
This is for you, Mom. I hope I'm making you proud.
Since the adventure with patient MC, Doc Ding has been continuously challenging the boundaries of medical technology, developing new gadgets for the treatment of other diseases.
Dear God, thank you so much for being there with me, especially during the times when I needed you the most. I almost didn't make it outside her body, but later on, you led me to this doctor who helped the patient recover from her pain. May you please always continue to guide and bless her and my future patients. I promise to do my best in providing quality healthcare. That is all I ask for now. Amen.
Hi Doc, this is for you po.
We are pleased to have you as our inspirational speaker for this year's commencement exercise of San Beda University College of Medicine. Let us all welcome our commencement speaker, Dr. Doreen Ding Makabuhay.
Technology revolutionized the practice of medicine, and so has the brilliance and the curiosity of every person like me. In this school, at the heart of Menjola, I was educated and received my formal education to become a doctor. I grew up with no father and was raised by a single mother who died due to UTI when I was only 13. The streets of Menjola became my home where I sell sampaguita outside of the abbey, until one day, a Benedictine friar called my attention and sheltered me here at San Beda. The Benedictine supported my schooling as I became a part-time working student at the university. During my medical school days, it was not easy to juggle work and study as I would fail several long tests in neurology and almost failed my anatomy practicals. But what made me stay? I wanted to finish my studies and become a doctor, to serve my community and offer the help to the needy through my unique inventions. I took the unusual path of becoming a physician-scientist. To you, our dear future licensed Bedan MDs, our hopes are all with you and congratulations on fighting for your dreams. And to God, thank you for being there since day one and reminding me not to give up in life. We continue to dare and work our way to more victories. That in all things, God may be glorified. Animo San Beda.